So if you're trying to conceive, you'll know that there's a variety of methods out there that promise to help you track your fertile window and help you have a quick and efficient process to get that positive pregnancy test. So we need to look at the clinical efficacy on which of these methods actually have good evidence on supporting the chances of having a positive pregnancy test and having a live birth, and which methods perhaps don't have as much evidence and may cause more stress and harm than good for certain patients as well. So when we look at the different methods, we're going to divide them into two categories. Two main categories are predictor test kits, so things like ovulation predictor tests. These will check for usually one of two different hormones. It will check for something called luteinizing hormone, which is a hormone produced from the pituitary gland of the brain and signals the ovary to ovulate, or it might be a type of estrogen as well, which can help predict that fertile window. And that fertile window specifically usually refers to the 5 days before your ovulation and is the time frame in which these methods recommend trying to conceive if you are attempting natural conception. The other main method that can be used are classified as something called fertility awareness-based methods, and this is the umbrella term which can include a variety of different methods such as basal body temperature or BBT, cervical mucus monitoring, changes in symptoms or signs that would indicate ovulation for certain individuals, and etc. So these are the two main methods we look at, and there was a wonderful systematic review published recently that compared these two methods and tried to look at the evidence of which of these two methods actually helps patients to have a higher chance of getting that live birth rate or positive pregnancy test and positive clinical pregnancy. The fertility awareness-based methods, based on the systematic review, it appears that while there is limited research supporting its use, it is in fact very limited, and the quality of that data seems to be very low quality. So it doesn't seem to be clear if there is a proven benefit of using those methods or not. The researchers recommended that more data is needed, and this data is just too scarce at this time to help determine if those methods will actually help improve chances of getting a positive pregnancy test or not. They found very good findings, however, for the predictor test kits. They found that patients who used the ovulation predictor kits had about a 36% increase in getting a live birth rate compared to people who didn't use the ovulation predictor kits and just had intercourse throughout their cycle. So that ovulation predictor kit, the evidence supporting its use seemed to be of moderate quality and does seem to support a beneficial impact with its use as well. And they tried to look at what the negative impacts of each type of method would be on an individual's stress level, mood, quality of life, but again, the data was just too limited to draw any conclusions there. In my personal experience, I find that using methods like basal body temperature or BBT charting, for example, tend to cause more stress. More patients will report increased feelings of anxiety, nervousness, increased reports of having low mood when patients are doing BBT charting. And I think it's just because the nature of the charting is quite disruptive. You have to wake up every morning, usually at the same time, and the very first thing you're doing is checking your temperature. So I find the OPK testing, while again, there is a bit of investment to it in terms of finances, because you have to purchase the test kits, and taking the time to actually do the test kits, waiting to see if it's positive or negative. You're doing it usually for a few days at least to help figure out and predict when that fertile window is. But I find it's a lot less disruptive than the BBT charting. So I personally never recommend the BBT charting for my patients, although some very few cases have reported that they find it doesn't stress them out. They seem to be okay with it, and it does help them predict when they're ovulating. But I just find that the OPKs can usually do a much better job with it. With the BBT charting, usually we'll see false positives or false signals of like the temperature fluctuating, and it causes a lot of concern. Did the progesterone level shift, or did you ovulate? Did you have a second ovulation? Did you have what's going on there? So, and a lot of time when we correlate it with blood work, everything's fine. So I find the BBT charting can sometimes cause more stress and harm than actually provide a benefit in supporting our treatment goal, which is getting that positive clinical pregnancy test, whereas the OPK test seems to be less invasive and easier to accommodate in your day-to-day routine, and it's only for a short number of days as opposed to every single day of your cycle. That being said, there are some patient groups that may not be able to use the OPK test method, and that usually is a group of patients with polycystic ovarian syndrome that tend to have higher levels of luteinizing hormone throughout the cycle, so it can give false positive on the OPK test. This is not true for all patients with PCOS, but for some individuals. So often if patients have PCOS, we may recommend to them, let's do a blood test to confirm that your OPK test is actually accurate and that you are able to use that test as a reliable predictor for your future cycles if you're trying to conceive naturally. So at the end of the day, what's most important is to chat with your healthcare provider, and based on your specific conditions, your healthcare criteria, help figure out what is probably the most sustainable, least invasive, and most accurate method of helping you predict that fertile window to optimize your chances of conception. The systematic republished in 2023 that compared the fertility awareness-based methods compared with the OPK test found that OPK tests were able to increase live birth rates by about 36% relative to patients that didn't use any OPK testing and just had intercourse throughout the cycle there. So there seems to be a clinical benefit of using the OPK test. We don't have enough data for sure to know if the BPT charting or fertility awareness-based methods reliably can be used to actually improve chances of a successful pregnancy test.